Hello and welcome to Washington Unplugged. I'm Nancy Cordes, and today we're talking health care with Representative Gerry Connolly of Northern Virginia. He is the president of the freshman class of Democrats here in Congress, and he's one of at least 22 freshman Democrats who oppose the bill that was written by House Democrats because of the way it's paid for. Thanks so much for joining us. Tell us in a nutshell why you oppose the way this bill was written.
Well, I think the bill has lots of good features to it, and I certainly, like most of my colleagues, want to find a path to getting to yes. But looking at a tax increase before we have wrung out every possible cost savings, I think is a mistake. And I'm not convinced that there aren't more savings to be had. For example, the insurance industry has yet to put a dime on the table in terms of savings. The pharmaceutical industry has, the hospital association has, but we have yet to hear from the insurance company. I think, they've had profits that have gone up 428% in the last 10 years, while people's premiums and deductibles have doubled in that same time period. They need to put something on the table before we start talking about a tax increase.
Now, specifically, what you have a problem with is the way that this bill, this reform is paid for, which, as proposed, is a tax on Americans who make $280,000 alone or $350,000 as a couple, and that's a tax that could rise up to, I believe it is 5.4%.
That's right.
Why not make the wealthiest Americans pay for health care reform?
Well, I think it's important to know who are those people. A lot of those people are double earner income families who aren't necessarily wealthy, who also struggle with insurance and healthcare issues. And also a lot of those people we're talking about are small businesses who are taxed as if they were individuals, S-Corp companies, for example. So this isn't just the super wealthy. And I think that, again, whoever or whatever we're talking about in terms of taxation, why would we start the conversation with that? Why wouldn't that be something that's a last resort after we've convincingly and credibly identified every savings to be had?
And you're from one of the wealthiest districts in the country. What have your constituents said about this proposal?
My constituents are following this debate. They want health care reform. They're willing, I think, within reason, to look at financing of healthcare reform, but they want to be convinced, just as I do, that we've wrung out every possible cost savings in the system. Mm-hmm. And I'm not there yet, and I don't think my constituents are either.
Now, obviously, this is a big problem for Democrats. If they've got at least 22, maybe 32 freshman Democrats already saying that they have big problems with the bill, then you've got the Blue Dog Democrats. This doesn't even include them. They also have problems with the bill. You went to the White House to express these concerns. Did you meet with the president? And what was their response?
We did have a chance to meet with the president, and we met with his chief of staff. Unfortunately, the meeting got truncated because we had to return here to vote. We had a series of, I think, 18 votes. So we weren't able to continue the conversation. Hopefully, we will be able to resume that sometime this week.
Did they share your concerns about this method of paying for the bill, this surtax?
Well, I think right now they're trying to, at the White House, they're trying to preserve as much fluidity as possible so that they can inject themselves at the appropriate time in the legislative process. And I think everybody understands, certainly the president does, certainly Rahm Emanuel does, this is sort of the normal whoop and woof of legislative process. So you can't read too much into any one development. But certainly they would, I think, share the concern we have that this bill be meaningful reform, that it be deficit neutral, and that we're able to address the long-term cost curve of healthcare, getting it under control. We need to achieve those three broad goals.
Every single spending method that's been proposed has a lot of people arrayed against it. It's not just this surtax, it's also taxing healthcare benefits, which actually many of your colleagues support, but the president says, no way. How do you pay for healthcare reform if every single method that's proposed to pay for it gets shot down?
Let's look at savings. The problem with healthcare in America is not that we spend too little on healthcare, it is that we spend too much. We spend twice what the average industrialized country does anywhere else in the world, measured by percentage of gross domestic product or on a per capita basis. And we're not getting what we're paying for in terms of outcomes. So let's first look at what cost savings we can wring out of the system to help finance healthcare reform. I mean, in an ideal world, the entirety of healthcare reform would be paid for that way, without any tax increase, without any revenue enhancement. Now, we may fall short of that goal, but we ought to be pressing ourselves as far as we possibly can to achieve that goal.
It seems like the Speaker of the House has heard your concerns, because she came out and basically against the bill that her own committee leaders had put forth, said, well, I think maybe $280,000 is too low of a threshold. Maybe we should only be taxing Americans who make $500,000 as an individual and $1 million as a couple. Is that more palatable to you?
I think the Speaker made a real contribution in the debate in trying to narrow the differences, and by doing that, she puts more pressure on those who are writing the bill to identify more in savings. I think that's the right direction. And obviously we're going to be talking with the Speaker. She's been very kind in listening to the freshmen and the freshman concerns in several listening sessions, and we're looking forward to more of that dialogue.
Got it. Well, Representative Gerry Connolly, Democrat from Virginia, president of the freshmen in the House, thank you so much for joining us today.
Pleasure.
I appreciate it.
Thank you.
And you have been watching Washington Unplugged. You can find us anytime at cbsnews.com. Thanks so much for watching. We'll see you tomorrow.